Hello, everyone, and welcome to Cardinal Conversations, the podcast that introduces you to influential and innovative people in the field of physical medicine and rehabilitation. We're here on the last day of the annual assembly of the American Academy of Physical Medicine and Rehabilitation, and I have with me one of my dearest friends in the whole field and one of the most amazing people you ever meet, Dr. Michelle Gittler. Michelle, thanks so much for being here.
Darryl, thank you for having me.
So Michelle, you are chair at Schwab. You have so many titles. I think you're still program director, if I'm not mistaken.
I am.
I think one of the things I found most interesting about reading your bio, although I know so much about you, is that you have really done a lot to increase awareness of gun violence and firearm violence. And I know you live in a part of the city that experiences that. I do as well. I have many patients who have been shot in the back with spinal cord injuries, shot in the head with brain injuries. What can we do from our experiences as physiatrists to help prevent firearm violence?
Well, thank you. I think one of the things that we as a nation are uncomfortable talking about is this issue of firearm violence and firearm injury.
Yeah.
And not just the primary injury, the injury to the brain, the spinal cord, major multiple trauma, but there's this expansion, this ripple effect of injury to the persons that are closest to the individual who's injured, to the community, and what happens next. So I would just say that the first thing is we need to acknowledge it's an issue. And this becomes political when we start talking about the firearm. But any kind of injury that creates a long-lasting disability for someone that's going to impact what they do, where they do it, impacts their family, we just need to have the conversation.
Yeah.
And we have to acknowledge it's a real thing. One of the things we don't acknowledge well is that most people who are catastrophically injured by firearm violence are people who commit suicide.
Yeah.
And we don't talk about that. So just having the conversation. I'm not taking away anybody's firearm. I'm not interested in that anymore. When I was young and in my 20s, I'm like, that's the only way we need to do it. But really, the way we need to do this is to have conversation and create safeties on firearms and awareness of this, because with everything else that we interact with, there's safety tops on medication bottles. When you buy a kid a sweatshirt, there's no strings in the hood so they don't get caught up in that. There's ways we evaluate our food for safety. So, if we can prevent injury, if we can prevent death, why wouldn't we?
Well, I think that's so true. And I've thought I could probably call upon 5 or 10 individuals who have suffered injuries as a result of firearm violence that live within a 5-mile radius of each other, right?
Sure.
And they're in dense areas of population that have had these kind of experiences that could then go out along with the physicians, along with the healthcare providers, and create a level of awareness in the community that says, hey, put the guns in a safe place, put them away. Let's try to reduce gang violence. There's so much that can be done. So I encourage everyone out there to really give what Michelle has said some serious thought and do what you can in your local community. I think it's super important.
Thanks.
So Michelle, the theme of this year's annual assembly is the power of PM&R.
Power of love.
So you are certainly a superhero in the field, but what is your special power?
The person deep, not that deep actually, the person inside me would say, I have no special power.
Oh, that is not true.
I have no idea where that comes from. But I would say that my special power, aside from being able to bring people together, is I think it's the power of joy and the power of meeting people at a difficult time in their life and connecting with them the power of working with different physicians from different parts of the country and different specialties, and together finding the joy in what we do, because what we do is so cool.
Yeah,
and
that is so true.
It doesn't matter if we're doing neurorehabilitation or we're doing musculoskeletal rehabilitation, or we happen to enjoy procedures. I think that the joy of recognizing that in general, nothing's perfect. People that go into rehabilitation do that because we believe that people deserve the best physical exam, the best opportunity for improvement, the opportunity to be seen as a person and not just as a constellation of impairments or complaints. And when people recognize that in each other, we're so excited about what we do. And so I think that's my superpower.
Yeah, I would say you hit it on the head right there. If there's one word that describes you, it's joy.
Oh,
and
that's
if
great.
I were a patient at a rehab hospital, I would love to look up at you every day and see the smile on your face, the encouragement you provide. And it is those relationships that we have with our patients that allow them to know that we're people and we see them as people,
Yes.
not just as an injury.
Exactly.
Is so important.
Yeah.
So I know that you've been a big advocate for looking at the biopsychosocial determinants of health.
Yes.
And you live in a part of Chicago where that's so important. Tell us what you've learned about that and what the audience might learn from you in a brief, minute or two about those things that really affect people's lives.
Yeah. So as a practitioner, you've heard about social determinants of health. Many people are using the term structural determinants of health, and we're looking at these as indicators of overall health. And it turns out that health care, access to a physician, only covers about 20% of what our health outcomes can be. All of the rest are these structural determinants of health that look at things like your housing, your education, your ability to exercise, perhaps your use of cigarettes or drugs, your safety, your mental health, all those come together. And until health care understands that paying for a procedure does much less than taking a step back and widening the lens to understand how we can make our communities healthier places to work, play, live, learn. I think we're going to continue to be stuck. And we have to collect that in a meaningful way, and not in a way that's burdensome, and not in a way that makes people feel defensive. When you start asking people the questions about, have you been without food for X number of days, or have you had difficulty getting transportation? People are going to be like, oh, no, I'm fine. So we have to figure out better ways of getting that data, because taking care of somebody who lives in a single family home that has one or no steps to enter, that has people around to help them, is very different than taking care of somebody who maybe lives in a third floor apartment, who lives alone or is the primary care provider for their family. They're going to have different outcomes even if they have the same diagnosis. So we're measured in outcomes, but the measurement isn't fair. So I would say, let's figure out on how we really define the people we're caring for and how we invest in really making them better.
So thank you for that. That's very meaningful. We've just finished an election, and we're not going to get into politics about where you're at, but it has been interesting to see that many well-known celebrities have been saying they're thinking about leaving the country. I'm not saying that you would ever leave the United States. I know you love your family and where you're at, but if you were going to live somewhere outside the United States, anywhere in the world, where would it be?
Oh, gosh. I know it's
very
a cop-out.
Very unusual to see her speechless.
I know, it's a cop-out. Where we live is extraordinary.
Yeah.
Geographically, it's extraordinary. Culturally, it's extraordinary.
Right.
The opportunities are extraordinary. So I hadn't really thought about that. You know, I suppose the person in me that loves having a garden would have to go to like Tuscany or something.
There you go. I had a feeling you might say that. Yeah.
Yeah, but maybe the thing to do is figure out like how I could get a trailer that I'm driving around. I could drive around the world and stop off at all the small towns in different areas and eat the food in the hole in the wall or the alleyway, you know, like what is authentic about all of us,
right?
And not a fancy place. Like that would be what I would do.
I have a resident that graduated from our program who's out practicing now. She's been out about 1.5 to 2 years. She's locum tenens, and she has been everywhere from Florida to Alaska. Actually drove to this meeting in San Diego down the West Coast from Alaska. Amazing.
That's cool.
And of course, this year's meeting is in San Diego. We're here right on the water. Next year's meeting is in the mountains of Salt Lake City. So you're right. This is an amazing country with so much diversity, so much to offer.
Yeah.
Well, listen, Michelle, it's been a delight talking to you. I always love getting together with you. I wish you the best in everything, and thanks for spending some time with us.
Darryl, I love you. I'll do anything for you.
Thanks, everybody.
Thank
Bye
you.
now.